Hi everyone, welcome to this USMLE series. We're going to start with pathology, and under pathology, we're going to start with cellular adaptation. So let's start with a question. On a routine visit to the physician, an otherwise healthy 51-year-old man has a blood pressure of 154/92. If his hypertension remains untreated for years, which of the following cellular alterations will most likely be seen in his myocardium? So looking at this option, we have atrophy, hyperplasia, metaplasia, hemosiderosis, and hypertrophy. So the best answer here is going to be hypertrophy, and let's see why. So talking about cellular adaptation, so when a cell is exposed to a lot of stress, right? So if you have a cell and that cell is exposed to a lot of stress, their cells could undergo cellular adaptation. So they could look for a way to adapt to those stress. An example of those cellular adaptation include hypertrophy, hyperplasia, metaplasia, and so on. But if the stress is too much, that could lead to cellular injury. So that could lead to injury to the cell. And of course, if the injury is too much, then that could lead to cellular death, which we're going to cover later in the course of the lecture. So, but today we're going to be talking about one of the ways that the cell could adapt to stress. And the first one there is going to be hypertrophy. So, what's the definition of hypertrophy? So, hypertrophy is reversible increase in cellular and tissue size. So, the buzzword there is the size. So, increase in the size of the cell. And what's the mechanism behind hypertrophy? So, the stress stimulates the gene that are responsible for growth, which involve the release of growth factors, gene transcription, translation, which is protein synthesis, and hence increase in cytosol and organelles. And when we look at hypertrophy, hypertrophy could be physiology, so it could be a physiology response, or it could be a pathology adaptation. So when we look at examples of hypertrophy, so we have skeletal muscle hypertrophy, which could be seen in somebody who is lifting a lot of weight, right? So weightlifting because of the work overload in the muscle builder. So because of those workload, that stimulates the gene in those muscle, and that leads to increase in size, which is hypertrophy. The next example there is left ventricular hypertrophy. So what are the conditions that could lead to left ventricular hypertrophy? So looking at my diagram here, so let's assume that this is the right atrium, this is your right ventricle, this is left atrium, and this is left ventricle. So if somebody have anything that could increase the afterload, right? So anything that could increase the afterload, that means the ventricle has to contract more harder to be able to push the blood from the left ventricle into the aorta. So a classic example would be somebody who have a long-standing hypertension. So if somebody have a long-standing hypertension, very high blood pressure, that could increase the afterload, and that could put a lot of stress on those muscles, causing gene activation, everything we spoke about earlier, and that could lead to left ventricular hypertrophy. And as a matter of fact, left ventricular hypertrophy is actually the most common complication of long-standing hypertension. And of course, that could produce S4 heart sound. The other one is, what about if the valve is stenosis, the aortic valve, and it's not opening very well? So as a result of that, that could also increase the left ventricular afterload, and that could also lead to left ventricular hypertrophy. The next there is right ventricular hypertrophy. So similar thing that happen on the left could happen on the right. So if somebody have a long-standing pulmonary hypertension, whereby they have very high pulmonary pressure, so that could increase the left ventricular afterload, and that could also put a lot of stress on the right ventricle, and that could lead to right ventricular hypertrophy. What about the valve? So if somebody have pulmonary valve stenosis, similar thing could happen. That could put a lot of pressure on those right ventricle, and that could lead to right ventricular hypertrophy. So moving on to smooth muscle hypertrophy. So this could also increase in size due to stress. So example of those stress could be somebody who have a bladder outlet obstruction from benign prostatic hyperplasia. So with those obstruction of those prostatic urethra, then that could increase the pressure on those bladder, because the urine will not be able to pass through. So that could lead to increased pressure on those smooth muscle of the urinary bladder, and that could lead to smooth muscle hypertrophy of the bladder. What about pregnancy? So during pregnancy, the uterine enlargements in pregnancy, due to both the pressure from the growing fetus and the estrogen that is coming from the placenta, both of them could also lead to uterine enlargement. And that's why with pregnancy, as the pregnancy continues to grow, the uterus also continues to grow. And the last example we have under smooth muscle is pyloric stenosis. So pyloric stenosis is a form of congenital disease that affects the outlet of the stomach. So with these patients, so they develop circular muscular hypertrophy, and this is causing gastric outlet obstruction. And those are the examples that we have on hypertrophy today. And if you have any question, don't forget to put it in the comment section. Don't forget to follow us on our different social media platform for more videos on USMLE. Thank you.